Well, we'll go ahead and get started. For those of you that don't know me, my name is Tevin Gillette, and I'm an occupational therapist, and I specialize in pelvic floor dysfunction. And that can range from things such as urinary incontinence, fecal incontinence, constipation, painful bladder issues, pelvic pain in general. So there's a lot that can happen in this tiny little area, and those are things that I treat. And today we are going to focus on the bladder. So hopefully you all will be able to leave today with learning some things that you'll be able to take home, and if you're having issues, be able to make those issues a little bit better, and if you're not having issues, to help prevent those issues from ever being a problem. You'll see that a lot of these slides are geared mostly towards women. However, we will discuss both men and women, those issues, and because everything that I'm going to teach you today applies for everybody. So urinary incontinence is the involuntary loss of urine. So we don't want this to happen. And it can be a social or a hygienic problem. And urinary incontinence along with prolapse are issues that come along with a weak pelvic floor. And we'll be discussing more about the pelvic floor and how to strengthen the pelvic floor. But prolapse is when some of our organs actually start to drop down and even fall out of the openings. A bladder, now this is for women, typically men do not have this issue, is a cystocele. Rectocele is a herniation of the rectum into the vagina. And then women can also have a uterine prolapse. Men can have a rectal prolapse, where the lining of the rectum actually does come outside of the body. So that is something that can happen to men. Some statistics when it comes to urinary incontinence, as you see on this slide, 10 to 30% of women between the ages of 15 and 64 have these issues. For men, those statistics aren't quite as high, but they definitely do have these issues as well. In the United States, the annual cost of incontinence is estimated to be around $16.3 billion, and that includes medication, incontinence pads or products, surgeries, those types of things. So this is a very big issue. According to the National Association for Continence, on average, people wait around 6.5 to 7 years to actually go to their doctor and start discussing these issues and actually receive a diagnosis of urinary incontinence. We wait. It's embarrassing. We don't want to talk about it. And we kind of think it just comes along with the territory. As a woman, if you've had children, and as you're getting older, sometimes we think that's just what happens and we just have to live with it. The good news is you do not have to live with it. Behavioral treatment is successful, that's what I do. I do the behavioral type treatment, very non-invasive treatments, no medication, no surgery, that's not what I do. Can be successful in 84% of the cases. And that's a pretty good statistic when it comes to even your medications and your surgeries. And then sometimes doing this along with the medication or surgery can be very beneficial as well. 40% of people who do their Kegels, Kegel is the name of the exercise you do when you strengthen your pelvic floor, and we'll go over that a little bit more in a few minutes. But 40% of women, or men too, probably that percentage is a lot higher in men, are actually doing their exercises wrong. And that is, you're at home actually trying to do these on your own. Most of us don't even think about this area. We aren't going around doing exercises. But those of us who do try to do them, a lot of us are doing them wrong. And so they didn't help. So we stopped doing them and just kept living with our problem. But as you can see, incontinence is a very common condition, but leakage at any age is never considered normal. You should not be doing it. And so if that is a problem, definitely discuss this with your physician. There's different types of incontinence. Stress incontinence, that's the type of incontinence you have when you cough, laugh, sneeze, exercise, when you cause that sudden pressure and then some of the urine leaks out. Urge incontinence, that is when you may get a big sudden urge to go to the restroom, and then you may leak on the way. You're trying to rush to get there and you don't quite make it in time. Functional incontinence, which we're really not going to discuss today, is more if you've had a functional change, maybe you broke your hip, your leg, and your mobility is different, you're slower. You may start to notice some incontinence in that situation just because you're not used to it taking that long to get to the bathroom. And then urgency and frequency. This can come along with incontinence or without incontinence. I see patients who aren't having any type of incontinence, however, they're living in the bathroom. They feel like they have to go all the time. So they have a lot of that urgency and frequency type issues. And as you can see from this slide, most people have a little bit of both, the stress and the urge incontinence going on. It's very common to have kind of both components at some degree. One may be worse than the other. It typically starts off with one, and then because of habits we get into trying to keep that from happening, it leads into the other. So this slide talks a little bit about potty training and beyond, but what that means is, or what we'll discuss here is that, from a very, very early age, we don't think about our pelvic floor. We don't really pay attention to what's going on there. Using the restroom is a very passive process. We go in, we do our business, and we go on. We may play on the phone a little bit, pet the dog or the cat if they snuck in, but we don't really think about it, what's happening in this area, just from a very young age. In other countries, and I'm very glad this is not the case for us, some people actually have to hover over a hole in the ground. And so from a very young age, they are actively engaging those muscles, to make sure that they can get positioned how they need to get positioned, reposition if, to make sure they don't make a mess. So they're actively from a young age using these muscles and are a little bit more aware of them. I'd say, that situation's changing a lot around the world, but it definitely still goes on. But then for women, maybe we get pregnant, and just the act of pregnancy is a lot of pressure on the pelvic floor and the bladder. And then we have the baby, and even with a C-section, that's still a lot of pressure on that area. But vaginal delivery can be very traumatic to the pelvic floor and those muscles and the bladder. And a lot of times this is when we start to first see the stress incontinence. So maybe we've had our children, and then we go to jump on the trampoline with them or try to exercise, and all of a sudden we leak a little bit. Or we're in the line at the grocery store and we sneeze, and oh my goodness, I just leaked on myself. Well, what happens then is we think, well, before I leave the house next time, I'm going to make sure I go to the bathroom. I'm going to do it just in case. And then we start going more often and more often, and that can get in the habit of that frequency, urgency, and then lead into that urge incontinence. And so then as women get older, we start to become perimenopausal, menopausal. Hormones change. That lack of estrogen can really affect the tissues that line the urethra, and where the estrogen kind of plumped up those tissues like a washer on a faucet. Those tissues start to thin out, and a lot of times that's when if you had urinary incontinence, it may become more pronounced at that point. or that may be when it even starts. Plus, those muscles have just along the way gotten weaker and weaker and weaker, because if you don't use it, you lose it, and you probably haven't been doing your Kegels. For men, typically men do not have issues until there's maybe a prostate problem. Sometimes an enlarged prostate's going to cause issues, prostate surgery, having a prostatectomy, your prostate removed. I see this a lot. A prostate surrounds the urethra and actually kind of acts like a dam. You have that removed, all of a sudden your dam's gone. And you've never had to think about using these muscles. This is a male pelvis here. Those are those deeper muscles that surround your pelvis. And you've never really had to pay attention to these before because you had your prostate. Well, now that's gone, and you really don't know how to activate or use, or they may be very weak. So a lot of times these exercises can be very, very beneficial to men who do have prostate issues or have had their prostate removed. They can also be very good for issues with erectile dysfunction. Brings blood flow to that area, strengthens those muscles that surround and allow for that to happen, and can be very beneficial for that as well. So, some normal bladder values. Normal amount of times to void in the day is around 6 to 8 times a day is normal. Now, granted, there's lots of things that can fluctuate or make that different. Certain medications you may be on. You may be on some diuretics or something like that. But there's definitely some things that can affect that. But typically, 6 to 8 times in a 24-hour period. At night, 0 to 1 time a night is normal. Unless you're 65 years old or pregnant, 1 to 2 times a night is normal. A normal amount, so do you know, are you doing too many just in cases? So when you go to urinate, if you count seconds, 1, 1,000, 2, 1,000, 3, 1,000, or you actually have a stopwatch, or you should be counting at least 10 seconds or longer. That's a pretty full bladder. It was time to go. If you're counting 4 seconds, 5 seconds, you're probably doing some of those just in cases and going maybe a little too often or a little sooner than maybe you really needed to. But there's also some things that can cause that bladder irritation and some different things too. But typically, normally, a normal healthy bladder can hold it that long. Hydration. This is so, so, so important when it comes to a healthy bladder and your bowels. We need to make sure we're hydrated, and we need to make sure we're drinking the right kind of fluids, and we'll go over that a little bit more in a few slides. But definitely make sure you're getting enough fluid. A lot of times when we have leakage, we think, oh my goodness, if I drink more, I'm just going to have more leakage. Or I'm going to go to the bathroom more often. I'm already going 10 times a day, and she wants me to drink 2 more bottles of water? Is she crazy? But what happens is when you don't drink enough fluid, your urine's more concentrated. When your urine's more concentrated, it's very irritating to your bladder. Doesn't like it, wants to get rid of it. And so it can actually cause more urgency, frequency, and leakage when you aren't getting enough fluid. So your symptoms can actually improve. Now initially, sometimes my patients come back and they're like, or they tell me originally, no, every time I drink water, I'm living in the bathroom. I can drink this diet soda all day long and I'm fine. But then I drink one thing of water and I'm rushing to the bathroom. Well, 9 times out of 10, it's because they're actually chronically mildly dehydrated. They're chronically retaining some fluid. They notice some swelling in their feet. Their rings are tight. And then when they finally do start to hydrate themselves, their body says, finally, and can start letting go of that retained fluid, which is a good thing. But that first day or two, when you do increase your fluid, you may notice that you are going a little more frequently. But it'll balance itself out. The color of your urine should be very pale yellow. So, if it's dark, has a strong odor to it, you're probably not drinking enough. Medications can change the color of your urine. So a lot of times your multivitamins and different things will tend to make it very bright yellow. but not that dark yellow that you want to avoid. So, there may be some medications you're on that may actually affect that color. So a little anatomy here. The core and the pelvic floor work together. Usually if we're weak in one area, we're weak in both areas. So, working on core strengthening, core exercises kind of goes along with this. So your core is going to be your belly, your back, and your bottom. And your pelvic floor are the muscles. So the muscles that line the pelvis here. So this is a female pelvis. These muscles here would be just, if I laid this in and lined the pelvis, and a male pelvis is going to be a little more narrow. This would be the male pelvic floor. And then, of course, the organs. And the organs for women are going to be the bladder, uterus, if you still have one, and then colon and rectum. For men, mostly the issue would be with the rectum. The white arrow here is where your pelvic floor muscles should be. That brown line that you see kind of dip down, that is what happens when the muscles get weak and start to sag. And then things can start to sag right along with it. This is a picture, kind of this view here. And for men, actually would be this view. And what it's showing you is that there's some superficial muscles here. So very superficial, kind of closer to the surface of the skin. And then the deeper layer. So here's the superficial for women, and then the deeper layer for women. And you can see it's kind of like a sling or a hammock, supposed to hold everything up and in. So supportive function, supposed to keep our openings closed until we want them to be open. So that sphincteric function. And then obviously there's a sexual function as well to these muscles. Things that can affect your pelvic floor muscles are pregnancy and delivery. We kind of discussed that. Bearing down on the pelvic floor in daily life. Men, I see this a lot, men and women. So if you have chronic constipation and you're constantly straining to have that bowel movement, that can do a lot of damage to your pelvic floor muscles. And in my men, I've seen very severe cases of constipation where then they ended up with a rectal prolapse. So constipation. If you have a job where you do a lot of heavy lifting, and you're constantly trying to pick up something and you're straining and bearing down when you're trying to lift something up and not using good body mechanics, over time that can do some damage and some prolapse. I knew somebody who decided to move furniture on her own one day. She wanted to kind of rearrange and dust and didn't want to wait for anybody. Well, she ended up having to have her uterus tacked back up. She pushed and pulled and strained so hard, didn't know to use these muscles. They were already weak, and she ended up pushing her uterus right on down outside of the vaginal opening. So that can happen. So very, very important to be aware of these muscles and use these muscles when you're lifting, bending, exercising, those types of things. Chronic coughing and sneezing. I see this a lot. I see patients who finally get into me because they just got over, about a bronchitis where they coughed for a month, and all of a sudden, they couldn't control their leakage at all. Because just those muscles, they're already weak, and that coughing, sneezing, constant. So even allergies could cause this. If you had chronic allergies that weren't under control, could cause some problems there. So definitely that's something, if that is an issue, to try to get under control. Obesity. Anytime we have a little extra around the middle, that's more pressure on the bladder and can cause some of these issues. Menopause. We talked about the hormones and how that can affect things. Some gynecological surgeries. So women who've had hysterectomies, that changes your support system. They've removed things and you don't have the same ligaments and things holding everything up, and you are more likely, more susceptible to the possibility of having a bladder prolapse at that point. Lack of pelvic floor exercises. So you just don't do your exercises, just like if you don't exercise any other muscle in your body, you're going to have problems, whether it be pain or weakness. So, that's definitely an issue probably for most of us. The ones that have the little pink asterisks next to it are the ones that we do have some control over. Obviously, there's certain things that happen in our life we have no control over. But those are things that, if that's going on in your life, you may need to see what might be causing that and see if there's anything you can do to fix that. So, some physiology of the muscle. Was not my favorite subject, but we'll go over it anyway. The pelvic floor muscles have two different fibers in them. Fast twitch fibers, slow twitch fibers, and they kind of all intertwine together. And same thing with different muscles in our body. Fast twitch fibers, those are our strength fibers. Those are the ones we should be able to pull up and in really fast, really strong, to hold back that cough, that sneeze, to counteract that pressure. Problem is, they can't maintain that for very long. They can maybe get up there for a few seconds, but if you try to hold it at that strength very long, it's gonna go like this. The marathoners, or the slow twitch fibers, that's your support fibers. Those are the fibers in those muscles that are gonna help keep everything up and in. Be that supportive structure in the pelvic floor. They also help keep you continent in your sleep. There's a certain resting tone that those fibers hold. They help get you to the bathroom on time. So both sets of fibers are very, very important. And the importance of this, you're probably like, why is she telling me this? Is when you're doing your exercises, your Kegels, here in a few minutes, we'll talk more about how many to do and how often and how long to hold the contraction. And so you're working both sets of fibers. When you do your Kegels, you want to make sure you're exercising both fibers so you get the benefit of both of those. So, like any other muscle in the body, the pelvic floor needs to have full range of motion. Just like, we want to be able to raise our hand up, and have full range of motion in our shoulder, or full range of motion in our knee. Same thing with the pelvic floor. Pelvic floor needs to be able to lift. So that's going to be when you're practicing the pelvic floor exercise, the Kegel, you're going to be tightening and lifting, almost like an elevator. But they need to be able to relax too. I see patients who are unable to relax their pelvic floor. It's called a non-relaxing pelvic floor. And a lot of times what I see here is pain. They have chronic pain with intercourse, constipation, inability to empty their bladder completely because those muscles keep tightening up on them and they're not able to get all that urine out. So there's lots of things that can happen if those muscles aren't able to just chill out. And they should be able to stretch. So we should be able to lift, relax, and then even gently stretch. And the stretching is going to be more, again, for a healthy bowel movement, that type of thing. And, obviously childbirth as well. And the pelvic floor works together with your lower belly muscles. Those muscles are your transverse abdominal muscles. They are the deepest layer, and I think this next slide, no, we'll go over that. They're the deepest layer of your abdomen. So we have our rectus abdominis, run this way. We have our obliques, kind of run this way. And then we have our transverse abdominis that runs this way, and they're deep. They're under all of that. So when you're doing your Kegel, if you're doing it correctly, you may feel a little tightening of this area. And sometimes my patients will come in the next week and they'll say, wow, I'm really sore here. I had one patient tell me, are these supposed to make my pants fit better? These are easier to button now. she was toning up a little bit of her abdomen here. So these are synergistic with that pelvic floor. So when you pull up, you may feel a little tightening here, and that's good, that's normal. All right, so how do we find these muscles? Because we're going to go home and start exercising these muscles, so we need to know where they are and make sure we're using them correctly. We need to know how strong our muscle is and how long we can hold the contraction. This information is going to then be used to develop your own home program. Different ways to make sure you're using the right muscle. One of the easiest ways is to do the stop urine test. This is when, now you do not do this every time you go to the bathroom. Your bladder will be confused. Am I supposed to start, stop? What do they want me to do? Test yourself every once in a while, once a week. See if you're able to shut your urine flow off. And if you're doing it correctly, you'll feel tightening in your rectum, vagina for women, and then a lift like an elevator. And that's kind of what you're looking for, and it should stop your urine flow. If you have weak pelvic floor muscles, it may just keep going full force. If you have moderately weak muscles, you may notice it slows down a little bit, but then it starts back up. For men, you're going to be able to pucker the rectum, lift like an elevator. And if you're sitting down or laying down, practicing these, and even if you're trying to use the restroom, the penis will rise up. There'll be some movement there, and then you know you're using the correct muscles. You can do a self-evaluation. So for women, you can insert an index finger into the vagina and see if you're able to squeeze it around and feel, kind of a squeeze or even a lift feeling. For men, they could do this rectally as well. You can use a mirror, men and women. You just kind of place a mirror, get in a semi-reclined position, place a mirror there, and then what you would want to see is the anus kind of winking, kind of pulling away from you, this area kind of moving. Then you know you're using the right muscles. So we hopefully figured out where those muscles are and how to try to activate them. Now we can decide if we have the anti-gravity function. If you have the anti-gravity function, then you are able to pull up and stop your urine flow. So you could pull up against gravity and shut off that urine. If you couldn't, then, and this is going to determine kind of what position you may do your exercises in to start off. How long can you hold the squeeze? So when you're pulling up and in, start counting. 1, 2, 1 Mississippi, 2 Mississippi, or 1 1,000, or if you've got a clock, start holding. And if you feel it kind of giving away, about 5, then 5 is going to be your starting number. How many repetitions can you do? And by the way, you would just go up to 10 on that. How many repetitions can you do? So say 5 is your number. Then what you would want to try to do is squeeze and hold it for 5 seconds, and then relax for about 5-10 seconds. Do that again, 5 seconds, then relax about 5 to 10 seconds. See how many times you can actually hold that 5-second squeeze before you start to feel like, I don't even think I'm holding it anymore, or maybe I only made it to 3 seconds that last time. And so maybe you got up to 5 repetitions. So that would be a starting point for your home program. And there's going to be some sample exercise programs here in a minute for strong muscles and weak muscles. So you'll get a better idea of how to determine that. So position. Not everybody's going to start off doing their Kegels in the same position. If you have very weak muscles, you are not able to, when you tried to stop your urine flow, nothing happened. You felt, it just kept going full force. then you want to do a gravity-assisted position. Now, some of these positions will be a little hard for a lot of us to get into, especially because they're actually holding their bottom up off the ground there. But all you would have to do is prop a couple pillows under your bottom so you're comfortable. Make sure you're not straining your back. And that way your hips are higher than your shoulders. Then what happens, here's your pelvic floor. So then when we try to contract that pelvic floor, gravity is helping us pull those muscles down and can help get you a little more aware of using those muscles. If you were able to maybe slightly slow that stream down or deflected it a little bit, then you may want to do a gravity neutral position. And in this position, your spine's just parallel with the ground. So you can be on your back, maybe put some pillows under your knees just to be more comfortable on your side here, even on your hands and knees if that's a position that you can get into to kind of practice some. So gravity's not hurting you, so you're not trying to pull up against gravity, but it's not necessarily helping you and making it too easy. You want to challenge yourself. So that would be a way to kind of start off. Ultimately, we want to work towards being able to use the anti-gravity function. So be able to do these exercises sitting or standing, and then even translate using these pelvic floor muscles into exercise and lifting and bending in our regular daily activity to help keep things from leaking or prolapsing. Now, isolating the pelvic floor muscles. I see this all the time. 90% of my patients that come in, when I first have them try to do a Kegel, butt cheeks, squeezing right in along with them. So they're squeezing everything together. Or they may be squeezing their thighs together. And you see this a lot of times, and now everybody's going to go pay attention every time you hear somebody sneeze. If somebody with a weak pelvic floor who does have some leakage coughs or sneeze, you'll see this, right? So we try to help ourselves. Those adductor muscles want to help try to keep everything up and in. Well, that's not your pelvic floor, so it's not always real helpful for that to happen. You want to be able to use the actual muscles for it. So if you find that you're having a hard time isolating these muscles, so only contracting that pelvic floor, then there's some different things that you can try. If you're one of those that just those butt cheeks keep squeezing together every time you do one, the easiest position to do for just about everybody would be this one here. So what you would do is find a wall. Make sure I don't fall off here. Bring your feet out slightly, comfortably. Turn your toes in, again, comfortably. And you don't have to be doing a big squat or anything, just slightly bent, toes in. When I turn my toes in, rotates my hips. When my hips are rotated or my glutes are on stretch, it's much harder to activate those muscles. So now I can just focus on the pelvic floor. So this is an easy way to do to make sure you're isolating them. If you keep squeezing those legs together, every time you do a Kegel, those legs keep tightening up and squeezing together, then really some of these positions would be impossible for me to get into. But just bringing your legs further apart. So if you're sitting in a chair, just bring your legs further apart, and that way you have a lot more awareness of what's going on there. When your legs are together, it's real easy. They want to just kick in. They want to help. Your body likes to compensate for a weakness, and so it wants to help itself. So a lot of these cheater muscles want to kick in and start helping out. So here, we talked about the synergy with the lower belly muscles, and so your transverse are those muscles right through there, and they've taken away part of the rectus and the obliques, and you can see they're underneath all of that there. So you'll feel that tightening through there. like I said, a lot of times when we're weak in one area, we're weak in both areas. So it's very good to actually exercise your transverse abdominal muscles. The transverse abdominal muscles are also nature's girdle. So they actually help pull everything in, give you a better posture, and protect your back. So a lot of times when we're weak here, we tend to have a forward tilted posture in our pelvis. So in a test you all can do when you go home, stick your bottom out, try to do a Kegel. Bring your bottom in, tuck it in, try to do it again. Figure out which one's easier to do. Much easier to pull those muscles up when I'm in that good posture. I'm using my transverse abdominal muscles. I can pull those muscles right up. I tilt my bottom, tilt my pelvis. It's much harder to pull those muscles up because now my muscles are they're stretched. They're in a position that physics doesn't allow them to be as strong. Whereas when they're like this, they can do their job. So, and a lot of times we get weak in our back and our core, and then we start that position where things just kind of start to hang here, and we get very weak. And so it makes it much harder to use those muscles. Now, planks are one of the best exercises you can do for your transverse abdominal muscles. However, these are not for everybody. If you have a bad back, I would not do this without somebody's guidance. If you have bad knees, these might be very difficult. If you have trouble getting in and out of the floor, again, I would not do without somebody's guidance or somebody there, making sure that you're doing it correctly. This is a way to modify it. So each way gets a little bit harder. This would be a full plank, or even she could come up on her hands too. She's on her toes and her elbows. The easiest ones, if you can get on your hands and knees, is just getting on your hands and knees and then focusing on pulling your belly button up towards your spine. Like somebody tied a little string there and lifting it up towards your spine and holding that. And you'll feel it, and it'll get a little burny and almost a little, some women describe it as a little crampy feeling, especially if those muscles are weak when you first start activating them. But there's many other ways to work these muscles, and typically when a patient comes and sees me, I tailor the program, the core program to, whatever the patient's ability is. And, we can work on different ways to strengthen the core if this is not a possibility. All right, let's look at some sample exercise programs here. So how often are you going to do your exercises? Now, this is how often are you going to do them to strengthen them. This doesn't mean you're going to have to do this many forever, but to actually strengthen your muscles. Up to 4 to 6 times a day. You're going to make sure you exercise those marathoners and those sprinters, those fast twitch and those slow twitch. The hold relax ratio, because remember, we want to be able to relax these muscles too. We don't want to just go around squeezing all the time because we could end up with a non-relaxing pelvic floor. And you can get spasms, almost Charlie horse type cramps in these muscles. It's difficult to do, and usually there's other issues going on that cause it, but you want to make sure you relax completely before you do your next contraction. For strong muscles, so you were able to shut that urine flow off, no problem. Then you want to do a 1-to-1 ratio. So however long you're squeezing, you're relaxing, same ratio. Weak muscles, 1 to 2. You want to give them a little longer to relax, to rest before they have to squeeze again. And how many reps? Go back to your initial evaluation. So we talked about, okay, I could squeeze it 5 seconds, and I could do that 5 times before I felt it going off the rails. Then that would be how many reps you would start off doing. So sample program for weak muscles here. 10 reps, 2-second hold, 4-second relax. So those are the quick ones. Those are the strength fibers. Those are the ones we want to pull up and in really fast, really strong for that sudden burst of pressure, that cough, that laugh, that sneeze. The slow twitch here is she's doing 7 reps, 6-second hold, 12-second relax. 4 times a day, and you can see that's the 1 to 2 ratio there, both of those. And she's going to try hers, or he, is going to try them on all fours, and then maybe try other positions. Now, sometimes people with weak muscles that maybe you would think you would start off laying down or hips elevated actually do a little better sitting because they get feedback off that chair. So they can kind of, if they're sitting still, they can kind of make sure they're not using their butt cheeks and their thighs, and they're not arching their back. You want to make sure these should not cause you back pain. If you start doing these and say, oh my gosh, these are killing my back, then you're using extra muscles. You're trying so hard that you're probably lifting your whole body every time you're lifting that pelvic floor. And doing that over and over again is going to make your back very sore. That shouldn't be happening. So if that happens, reevaluate your technique and how you're doing it and make sure you don't do that. But by sitting on a chair, you can kind of feel a little lift off of the chair, that surface that you're sitting on. And so sometimes it's almost like biofeedback. You're getting that feedback, and you can tell a little bit better if you're doing that exercise correctly. Stronger muscles, 10 reps, 2-second hold, 2-second relax, 10 reps, 8-second hold, 8-second relax. So the fast twitch fibers, the slow twitch fibers. And this person's going to do theirs 5 to 6 times a day, and they're very motivated in doing some squatting and standing. But for most of us, hopefully getting, being able to do these in a standing position would be very good. How to challenge your muscles. So again, we, just like if we go to the gym, we don't just go to the gym and lift 5 pounds for the rest of our life, right? Hopefully, eventually, we start lifting a little bit more and getting a little stronger and challenging ourselves and trying to do a little bit better. Same thing with your pelvic floor muscles. So if you started off lying down, see if you can sit up, then stand. Then to start using these muscles with your functional activity. Increase your hold time. So if you're only holding, 5 seconds, try 7 seconds the next week, or 8 seconds. Keep trying up to 10 seconds. 10 seconds is the max. Decrease your rest time. So if you're weak and you were doing 1-to-2 ratios, you were giving those muscles a little bit longer to rest, but you're feeling a little bit better, you feel like they're getting a little stronger, then start giving them doing the 1-to-1 ratio. So if you're squeezing 2 seconds, relax 2 seconds. 2 seconds, 2 seconds, 1-to-1. Increase your reps gradually, so about 2 reps a week, and until you get up to about 10 of each. So the goal here on this slide, my poor patients, make them do more. 50 a day is what it says here, and it says focus on quality, and that is so true. Quality, the strength will come down the road. Make sure you're breathing, don't hold your breath when you're doing these, and make sure you're isolating them. So focus on doing them correctly, the strength is going to come. If you're doing them wrong, they're not going to work very well. But I typically make my patients do about 60 to 80 contractions a day for a certain time period, and then we back off. Now, if they're very, very weak, I will not make them do that many. But if they're moderately weak, then I will start them off a little bit more. So it's one thing to have a nice, strong pelvic floor. You can kegel till the cows come home, right? But if you cannot translate that into functional activity, it's not going to do any good. Because how many of us, if we have any issues, have issues just sitting here or just laying down? It's usually when we go to get up to go to the bathroom, or when we're walking or exercising or sneezing or coughing. It's when we're doing something typically, or getting ready to do something, is when we have our problem. So we need to be able to use these muscles in everyday life. And that's why I focus on isolate, 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 because if you're having to squeeze your butt cheeks together and hold your breath to do Kegel, well, how well would you be able to go up a flight of stairs? That would look kind of funny and probably be pretty dangerous if you're trying to squeeze all of that. So you want to make sure you can isolate those independently from the rest of your muscles. Lifting. So I'm sure everybody is already doing this perfectly, lifting exactly like we should. When you lift with your legs. They are the strongest part of your body. Do not use your back. Do not bend from your back. You're just asking for problems, whether it be back problems, pelvic floor problems, prolapse, leakage, all of it. Make sure you're using those legs. You want to gently contract your lower abdominal muscles and your pelvic floor at the same time. That's called the pelvic brace. That's the technique that I teach my patients. So you're doing a little baby squeeze. So not your strongest one you can possibly give, but about 1/3 of what your maximum contraction is. Now, if your muscles are very, very weak, that's going to be hard to really gauge that 1/3. But as they get stronger, you'll feel this. You'll feel that. You'll be able to tell that amount. And you want to make sure you exhale or breathe normally. A lot of times when we're lifting, we just go to pick it up and we hold our breath when we lift something. You want to make sure when you go to lift, so you're going to squat. I'm bracing, so I'm doing a little squeeze here, Exhale when I lift it. That will keep you. Now, and this is something you all can just do sitting here if you want to. A lot of times people look at me like I'm crazy. So as you're sitting here, I just want you to go, just grunt. What do you feel happen in this area when you did that? Pressure, right? So if we're grunting, we're straining, inner abdominal pressure is pushing everything down on our poor little bladder and our poor little pelvic floor. And if we're not using these muscles well, then we probably just had an accident. So make sure, exhale. That keeps that added pressure off of your bladder and your pelvic floor. Or if you're able to just breathe normally, make sure you're not holding your breath when you lift. Also, keep whatever you're holding close to your body. So don't hold it out awkwardly. Make sure it's close to you. You do not want to twist and set it down. Make sure you move with it. I'll brace again, squat, and set it down. So, be very aware of good body mechanics, and it can make a huge, huge difference. Coughing and sneezing. There's a technique called the knack, and that's a term a therapist in Australia came up with. The knack, this one technique alone, if you are having stress incontinence with coughing, laughing, sneezing, this one technique alone can significantly reduce your episodes of stress incontinence just by doing that. Now, if you have very, very weak muscles and they're barely able to squeeze, it's not going to be as effective. As they get stronger, you use this, it's going to be beautiful. Basically what you do, anytime you cough, laugh, or sneeze, squeeze. Tighten those muscles. That keeps the leakage from happening. Think of your body as a tube of toothpaste, okay? Tube of toothpaste here. Pelvic floor is the lid. So that's the lid to my tube of toothpaste. If I tighten that lid, pull it up, and I squeeze that tube, so my lid's nice and tight on my tube of toothpaste, what's going to happen when I squeeze it? Nothing. It's going to stay in. If I don't pay attention to the lid, it's barely hanging on, I squeeze that tube, what could happen? Toothpaste comes out, or in this case, urine, potentially. And even, for some people who have fecal incontinence, this can be an issue too. So always think about putting the lid on your tube of toothpaste when you cough, laugh, sneeze, or do anything that's very jarring. You want to, put that lid on. Bearing down during bowel movement. So this is, and I see this a lot of people are constipated. And constipation wreaks havoc on a pelvic floor. It's hard, heavy stool, sits right on top of that bladder. So it can cause more urgency, frequency, and potentially leakage. Then if you're having to strain when you're having a bowel movement, over time, that can do damage and even cause prolapse. So if that is an issue for you, this is something you also need to look at and take care of if you want your other issue to be better. So if this is a problem, talk to your doctor. If you want to, try increasing your fluid. A lot of times we're dehydrated and we're just not getting enough fluid. Drink warm liquids, especially in the morning. A warm beverage in the morning can help kind of relax things and get things going a little bit. Add more fruit and fiber and veggies. I don't know why veggies isn't on there. Make sure you're getting enough fiber. Does anybody know how much fiber we should be getting? You probably do. Anybody else? 25 to 35 grams of fiber a day. Women, 25 is good, men, 35. Typical American diet, 14 to 15 grams of fiber a day. And really, that's actually higher than most of my patients. Most of my patients come in, they're getting about 5 to 10 grams. I make everybody do a log. They have to do a bladder log and a bowel log for me. So I know exactly what they're eating and drinking and when they go, and so we can see what we might need to adjust in that direction. If you add fiber in your diet, so don't go home. If you're not getting enough fiber, don't go home and go crazy with it. So you'll be calling me, what have you done to me? No, it'll make you gassy, bloated, uncomfortable. Your body's not used to it. Your bowels are slow learners. They don't catch on really fast. When you make a change for the better, you got to ease into it. And it can take a couple weeks to see the full effectiveness of your change when it comes to making a change for the better with your bowels. A lot of people, when they have these issues, they want that quick fix, and they don't stick with it because, again, maybe it made them gassy, bloated, or it didn't work. Well, they didn't give it long enough to work. So remember, slow and easy wins this race. Ask your physician if you need to take a stool softener. Some people are on medications that automatically are going to be fighting against you. That could cause constipation, so you may need a little extra help in that department.
Ma'am?
Yes?
Do you recommend those Metamucil, things like that, to get your fiber?
So always better to get your fiber in your food. It's going to be fruits and veggies, nuts and seeds, legumes, whole grain breads and cereals. Always better because you get all the nutrition out of those. And those are all, nobody ever got chunky eating fruits and vegetables. So very healthy, we get a lot of good stuff out of that. If you feel like you just cannot get enough fiber, because you would have to eat a lot of those types of foods. If you feel like you can't get enough, then absolutely, if you want to add a fiber supplement. Metamucil's one, Benefiber's one. So there's definitely different ways you can add the fiber. And again, just start slowly. Like for instance, Benefiber, 1 serving's 2 teaspoons. 2 teaspoons is 4 grams of fiber. So if my patient's gonna go that route, 1 serving a day for a week. Let your body get used to it. If you need more, that second week, add that second serving. You can go up to 3 servings a day of that. So sometimes they read the label, 3 servings a day, and immediately they jump into that 3 servings a day, and they're miserable and swear they can never eat fiber ever again. So definitely a fiber supplement can be very beneficial if you just cannot eat enough food. And some of us just don't have big appetites. We're not big eaters, and it can be difficult. When you add fiber, also make sure you're getting plenty of water. Do not add a bunch of fiber and only drink 1 or 2 of these a day. But water helps it move through and do its job. So you want to make sure. And here's the fabulous thing about fiber. Not only does it keep you regular and keep pressure off your bladder, but it helps maintain healthy cholesterol levels, healthy blood sugars, healthy body weight, and it's the scrub brush of your colon. So fiber's moving through, it's cleaning those walls, getting them all sparkly, and it can actually help prevent some colon cancers and polyps from forming. So it's very, very good for bowel health in that regard too. So the next slide on your handout would be the urgency, frequency, and bladder irritation slide. And if you are having urgency and frequency and irritation, always start with your doctor. You may have an infection. There may be something else medically going on. So you want to rule that out first. And then look at what you're putting in your body that could be irritating your bladder. Caffeine. Caffeine's a diuretic. It's going to fill your bladder up much faster than regular water. So if you're drinking any caffeinated beverages, then definitely take a look at how much you're drinking of that. Nicotine, so any type of soda, so any carbonated beverages, anything with artificial flavors, colors, artificial sweeteners, acidic foods. So even spaghetti sauce, pizza sauce can be irritating for some people. Orange juice, citrus fruits can be irritating. So, evaluate these things and see, am I getting a lot of this stuff? If this is part of your problem. I typically tell my patients that a good rule of thumb, 2/3 of your fluid should be water. So if you're drinking, we'll say, 60 ounces a day, 40 ounces water, 20 ounces could potentially be, if you want a little bit of coffee or tea or, something like that. That will make for usually a much happier bladder. Now, if you have something more severe, like painful bladder syndrome or, something else going on, you may want to get rid of all the irritants. But typically, if you're just having some urgency, frequency issues, and we know it's not infection or anything like that, decreasing those irritants can really, really help. The next slide is urge delay techniques. The urge delay technique that I typically teach my patients is similar to kind of the puff and tuck that you see on that slide. Now, you can, to control that urge, you can apply pressure to the perineum. However, as adults, we can't get away with that in public very much. As a kid, we see kids doing that all the time. But we can't really do that in public. So a quick, easy way, and this is very effective, very, very effective, is when you have that sudden urge, oh my gosh, I need to go. I don't think I'm going to make it on time. The worst thing you can do is rush off in a panic. You set yourself up to leak. So what you want to do is stop when you think, oh, I got to go. Stop, do your Kegel, put tension in your pelvic floor. It tells your bladder, chill out, it is not time to go. Here's the catch. You can't sit here and go, oh my gosh, I gotta pee, oh my gosh, I gotta pee, oh my gosh, I gotta pee. You'll fight against yourself. It's mind over bladder. Squeeze, hold, get a different thought in your brain. What am I having for dinner tonight? Count backwards from 10. Something, look, grab, if you're at the grocery store, grab something off the shelf and read the label. It's only going to take a few seconds, and you'll feel your bladder go from, oh my goodness, to, wow, I don't even feel like I need to go anymore. And that's going to buy you time. If there isn't a bathroom handy, or if there is a bathroom handy, once you're nice and calm, walk normally under control to the bathroom. Your goal is to always make sure you feel in control before you take one step towards that restroom. If you do have issues with urge incontinence, that can almost get rid of it completely if there's not anything more serious going on. Urge incontinence can be a pretty quick fix for most of my patients. But it's hard. We're so used to taking off in a panic because we're afraid we're going to have an accident that the thought of stopping is kind of fearful for some of my patients. And this won't work. You can't do this on your way to the bathroom. It will not work. You're fighting against, your brain knows where you're going, and it's telling your bladder, and so you're going to have the same problem. So you have to stop, squeeze, distract. All right, you all have just had your first occupational therapy visit. So, any questions about anything? Yes?
Exactly what is the Kegel exercise?
So, the Kegel is, so we'll pretend this is a male pelvis. Basically, you're tightening the rectum and lifting it up like an elevator towards your head. If you're in the middle of using the restroom, urinating, you would be trying to shut your urine flow off. So that would be the same squeeze or exercise.
So it's basically associated with the rectal muscle.
Yes. You're pulling.
You can't control any of those other muscles.
So they're all, when you pull up and give that elevator lift, you're activating all of them.
Yeah.
All of them, yeah. But where you're going to feel it is that rectum and maybe a little lift in the penis. Okay. Is where you're going to feel it. For women, we'll feel it rectum, potentially a little vaginally, and then, just a deep lift is basically where we're going to feel it. And it's this, again, same muscles you would use to stop your urine flow or hold back gas. So if you got on a crowded elevator and you just had, some wonderful chili last night and you're having some issues there, would you be able to hold that gas back if you wanted to? And that's the muscles you would use. Now, that doesn't mean to do this, trying to hold it back, or squeeze your butt cheeks together, trying to hold it back, but being able to actually close the opening the gas would come out of and lift up to hold it back. And that's the Kegel. Yes?
If somebody comes to see you,
yes,
how many visits does it generally take, and how much does it cost, and does insurance help?
Yes, insurance, I think I've maybe run into 1 or 2 insurances in my career that didn't cover it, and it was a weird insurance, like something you've never heard of before. Typical commercial insurances, Medicare, they all cover occupational therapy, and it would just depend on what your copay is, if you had a deductible or a copay, that type of thing. So, whatever your insurance is. So, and if you have a copay for a doctor, doesn't necessarily mean you'd have a copay for therapy. But sometimes you'll have a copay for therapy even though you don't pay. So we always pre-cert the insurances so you'll know, going ahead, how much that you would be responsible for, if any. Sometimes my patients don't have to pay anything. A typical, if a patient comes to see me for urinary incontinence, typically 1 time a week for about 4 to 6 weeks, 4 to 6 sessions, and that's it. So it can be, fairly easy, quick treatment. And to come see me, I would need a doctor's referral. I can treat patients without a doctor's referral, but if we want your insurance to cover it, which we all do, they do require a doctor's referral. It could be a family doctor, urologist, a gastroenterologist, really anybody. Nurse practitioner, PA, physician's assistant, can all make referrals. And they would just fax it over, we'd call, and we'd get you scheduled. Okay, well, I appreciate you all coming. And if anybody does need to come see me, or if you know somebody that might benefit from this, definitely send them my way. I love what I do because it works. So, and I do practice what I preach. So. All right, well, thank you all. You're welcome.